Joining me today is New Hampshire Representative Neal Kurk, Chair of the House Finance Committee. Neal, let's continue our conversation and let's keep focusing on the priorities. What are the Republican priorities for this budget versus the Democrat priorities? Are they different? Are they together? Where do they overlap? Where are the divides?
It's hard to say specifically because I don't know what the Democrat priorities are for this budget. I haven't seen any. But I do know that there are some areas in the budget where the Democrats have taken positions, in particular the governor. And let's talk about Medicaid expansion. Mm-hmm. Under the Affordable Care Act, as interpreted by the United States Supreme Court, states have an opportunity, but not an obligation, to provide Medicaid health services to a new group of people, those people earning more than 133% of the poverty level.
And we did that in the last biennium.
In the last biennium, we passed a law participating in that program. The question, and that was done with a proviso that the program ends
at the end of
December 31st, 2016. Which is 3/4 of the way through the current biennium. So a decision has to be made whether or not we want to extend that program. Now, up till that date, the federal government is paying 100% of the cost of insuring these additional people, and right now it's 30,000 to 40,000 with the possibility of going up to 50,000 people. It will cost us money to continue in the program. Approximately 5% of the cost will have to be paid for the last 6 months of this biennium. Not clear how much that's going to be in dollars because it depends upon how many participants there are.
Right, and inflation in healthcare.
Yes.
Or efficiencies. I mean, it could be deflation.
Conceivably. But even if it's not, it's a significant chunk of money that we would add to the budget. But the issue for Republicans is not how much it will cost. It's whether or not that is an appropriate function for government. To what extent should this group of people, to give you specifics, a family of 4 earning around $90,000 would be eligible to participate and get a government subsidy. Now, Republicans think that we have the responsibility as individuals to provide health insurance for ourselves. Some of us do it by working for an employer. We take a lower salary, but we get health care as part of our benefit package. Some of us do it by not having health insurance. We are young and healthy and invincible, and we decide that we don't need it. Others of us pay for it out of our pocket or share the cost with our employer. As Republicans, we have taken the position that we do not wish to participate in expanded Medicaid. So, the budget that the House passes, I'm not speaking for the Senate, the budget that the House passes will not have that in it. There will be no extension. Now, the Democrats, because they generally take a very different position about the role of government in society, want the government to have a larger role and be more responsible for more things that people do. They will very much oppose that.
And the governor, is this something she'd veto the budget over?
Don't know. But certainly she has made it very clear that Medicaid expansion is very important to her.
So this is an area where, well, let me ask this. At the end of the day, will people compromise over this? Or is it like our heels are dug in, your heels are dug in, and do we have a tradition in New Hampshire of compromising?
Yes, we do. But obviously, some issues are possible to compromise. In some ways, it's easier to compromise on an issue where the question is how big the program should be. It's harder to compromise on an issue as to whether or not there should be a program at all.
Okay. So, but beside this, what else do you see as some of the big issues, priorities?
I think that's the one that is going to get the greatest amount of attention. Beyond that, it's the second kind of prioritization that I was talking about, where the question is how large the program should be. Should it be targeted to a different group of people? And those are things where you do make compromises, and they involve not just the particular program, but I'll concede to your point of view on Program 1, John, but you'll concede to me to my point of view on Program 2, and we walk away happily hand in hand.
Let me turn it really quickly because we've got about a minute and a half left. Gasoline tax or the road fee or what I can't remember the technical term for it. Feels like
road
a tax.
toll.
Road toll.
Which is the gas tax.
Yeah, the gas tax. So will that be up to be revisited this year?
I can't say, because I don't know if someone has put in a particular bill to do that, but I can tell you that the Republicans in the House will not be supporting a gas tax increase.
I understand that. I mean, the repeal. Or is that law settled, at least for this biennium?
My guess is that law is settled and there will be any effort to repeal will not be successful. But I can't make that as a firm commitment. I just don't know.
Right. I'm just but you're prognosticating. We're not going to hold you to it.
But I think you're raising a larger issue, and that is what is the appropriate level of funding our roads and transportation infrastructure? Do we have enough money going for it now?
Do we?
No. And the question is what we do, how we deal with that. In the past, we've done some one-time fixes. For example, we sold a chunk of road, I-95 going through Portsmouth, the bridges, to the turnpike system, which has the money because it collects tolls.
And speaking of having things and not having things, we're out of time. We don't have enough time, but we'll get back to that.